Hi, I'm Dr. Allison Rogers, and I'm a fertility doctor, and I'm here with
Dr. Lucky Seacon.
also a fertility doctor, and we wanted to talk to you today about HCG levels in early pregnancy because there's lots of questions about them.
Yes, so the HCG is the pregnancy hormone. And when you do a home test, you're able to pick it up in your urine sample. But we can also, as fertility specialists, draw a blood sample and test HCG levels in your blood work.
Yes, and we would like to see that first HCG level. Typically, I usually say between 50 and 150. What do you say? Same?
I think it depends on when you're doing the test because
True.
there's some variability. So I typically do my transfers on Thursday afternoons if they're frozen transfers and I can schedule them that way. And then 8 days later, the following Friday, I'll test, and I love to see at least a 50.
Okay, yeah, so we usually do it day 10.
Yes.
So that's the difference. But that being said, that the first number really isn't the predictor of whether you're going to be successful or not. Now, if the value's 2, that's not a great sign. However, I've absolutely seen values that are really low.
Yes. What's the lowest you've seen that's turned into a live birth?
11.
I've seen a 5, but granted, I test 8 days later.
Yes, but that would have been, the 11 would have been a 5 2 days later. And so really low levels can turn into healthy babies. So it's not about the level. It's more about how it's changing.
Right.
So we want to see it approximately doubling every 2 days.
Right.
So in 2 days, it should be double. In 2 days, it should be double. And how many times do you usually check it?
Usually I check it twice. There's that first test, and then I'll usually check it 2 to 3 days later. And I always tell patients, doubling makes me feel really confident, but there are studies that show that even a 53% rise over 2 days could be associated with a healthy, viable pregnancy.
Yeah.
So we give it a chance. And if it's at least a 53% rise, I continue the medications. Sometimes I'll bring patients back then for a third test.
I usually do 3, but that's just sort of my practice. There's no right or wrong with that. So when do we start to be able to see something on ultrasound?
So usually the earliest is about 5 weeks.
Yeah.
And there's not a whole lot to see. I feel like it's always such an anticlimactic moment because patients are like, oh my gosh, I'm finally going to see the baby. And then we show them this blob that's like a black circle, and that's called the gestational sac. And in it is another little circle, a white circle called the yolk sac. But that's just the structures associated with the pregnancy. It's not the actual fetus itself.
And sometimes if it, like truly at 5 weeks, you may not even see the yolk sac. You might just see that black hole without anything else in it.
Yeah.
But the reason that I like to do those 5-week scans is to make sure the pregnancy is developing in the uterus.
Yes.
Because certainly we want to make sure it's not developing in the fallopian tubes or anywhere else that would be considered an ectopic pregnancy. That's why I do that first scan. But I always tell people we're not going to be able to see a heartbeat or a baby quite that early. But when would we see a baby?
So typically the week after.
Yes.
So at around 6 weeks. And even that, it's like so tiny. It looks like a little jelly bean. And, you know, we measure the length of it. And then from there on, I start caring less about the HCG level.
Oh my gosh, yes. Actually, as soon as we see a sac inside the uterus, and some people request a scan, you know, the blood levels too.
Yeah.
Which is fine, but it's really like not needed anymore because at that point, once we can see something on ultrasound, we're following the ultrasounds, not the blood work anymore.
And it matters more about the rate of growth and the appearance of the flicker of the early heartbeat, which you can sometimes see as early as 6 weeks. See it really well, and you should be able to measure it well at 7 weeks and beyond.
So the other thing about fetal heart rates, maybe we should do a separate video on fetal heart rates.
Stay tuned.
Stay tuned, part 2.